our future depends on clean air. The U.S. transportation sector is the leading contributor to air pollution and greenhouse gas emissions, which contribute to climate change. 1 in 12 children in the U.S. has asthma, a life-threatening respiratory condition, which can range from mild to severe. Transportation pollution can exacerbate or worsen symptoms of asthma in children, affecting all aspects of life, from school to outdoor activities and socialization. Clean car standards are one of the most effective ways to reduce greenhouse gas emissions and toxic air pollutants from cars and light-duty vehicles. Today, we're going to discuss the impacts of tailpipe pollution on both children's education and health, and what can be done to keep kids safer as we head into another school year. My name is Jessica Mangasdub. I'm the Program Manager for Climate and Clean Energy Advocacy with the Alliance of Nurses for Healthy Environments, or ANNE, a national nursing organization working at the intersection of health and the environment. In my role, I work on outreach and engagement of nurses, nursing organizations, and ANNE partner organizations on climate change and clean energy advocacy campaigns. I also work in the acute care setting, specializing in maternal child health, caring for birthing individuals in labor and delivery and maternity. I draw from my background studies in sociology at Rutgers University and nursing at Villanova University to fuel my passion and work in community health, health equity, and environmental justice. Next, I'm going to turn it over to Gloria Barrera. Gloria works as a certified school nurse at a public high school outside of Chicago and as an adjunct professor. She is committed to being a lifelong learner and continues her efforts in improving child health outcomes in our most vulnerable populations through her current practice, advocacy, and teaching. Barrera is the first Latina president of Illinois' Association of School Nurses. She is an active representative of Hispanic nurses in Nursing Coalition on Climate Change and Health, and a fellow of the Alliance of Nurses for Healthy Environments. She has gained interest in addressing environmental health issues and protecting public health from climate change. She's been recognized for her leadership and community work by several organizations, both locally and nationally, and most recently was named 40 Under 40 in public health by the Beaumont Foundation. Gloria?
Thank you. After testifying for the first time in 2016 to elected officials in Washington, D.C., I realized the unique and important voice that nurses have when it comes to advocating for environmental health, and I really have been invested in doing more ever since. As you mentioned, I am currently an ANNE fellow and I'm training right now to tackle environmental health issues with an emphasis on climate and health equity at the grassroots community level. We know that the transportation sector is the largest source of greenhouse gases in the US. Numerous studies show that poor health outcomes and higher incidences of chronic conditions such as asthma can be linked to the volume of concentrated pollution in high traffic areas. So clean car standards are the most effective policy to reduce dangerous air pollution and protect the public health nationwide, especially in our most vulnerable Black and Brown communities, who are often more exposed to air pollution and really are the hardest hit by effects of climate change. I'd like to just quickly talk about what I'm seeing here on the front lines as a school nurse. In a classroom of, let's say, 30 students, at least 4 have chronic asthma. So those symptoms are exacerbated by hazardous air pollutants caused by the vehicles that drive them to and from school buses. So in 2022, just to kind of circle back, the Pritzker administration awarded over $4.2 million in grants, providing 17 electric school buses in the Chicagoland area and Metro East regions of the state. Vehicle manufacturers have the technology to meet these strong standards, and many recent analyses have shown that fully zero emissions buses will be cheaper to purchase and operate than diesel buses. But let's put our national school fleet on a clear path to 100% zero emission, meaning that all electric vehicles should be that way by 2035. I think it's just really a win-win for all.
Thank you very much for that personal and compelling perspective on how emissions and pollution are impacting our students as they just try to, go to school and enjoy school and be around their peers and continue their learning and all of the possibilities that come with increasing and strengthening our clean car standards. Next, we're going to hear from a middle school teacher, Mr. Aaron Ramos. Mr. Ramos is a veteran dance educator with over 15 years of experience in the field. He received his Bachelor of Fine Arts from Rutgers University Mason Gross School of the Arts in 2007. Mr. Ramos currently teaches dance at Franklin Middle School in New Jersey and was named Teacher of the Year in 2015. He was also featured in a mini documentary by New Jersey State of the Arts, along with his dance class, particularly his advanced 8th grade all boys dance class. Mr. Ramos?
Hi, everyone. Thank you, Jessica. I am very excited to be here. When Jessica asked me to participate, I am very happy and gladly do it because I truly believe that what this whole issue with pollution and health and all of that is affecting our students. My kids who have asthma, I've seen them negatively impacted by their situations. They can't fully participate when they really want to. Some kids tell me they only come to school for dance. So to me, it's very important that we are advocating for the future of our children. So I am here to offer my perspective and experiences with my students having asthma, how that's affected them mentally, socially, and physically. So I'm very excited to be here.
Thank you very much. And that speaks to a really important point. School is an important outlet for children for socialization, development, physical wellness, physical education. We all know, in addition to air quality, the obesity epidemic that is plaguing our youth and our country in general is very much real. So health and wellness and being physical is very important. But when the issue of air quality comes to the forefront and children who have respiratory issues or conditions or diagnoses are not able to participate in physical activities or organizations or sports after school or on weekends, just simply because of air quality, that's when we know that this is a problem that absolutely needs to be addressed. I'm going to turn it over to Elizabeth Hopman. Elizabeth is a Moms Clean Air Force field coordinator in Brighton, Michigan. She also coordinates volunteer engagement for Moms Clean Air Force across the U.S. She's a vegan chef, organic vegetable gardener, volunteer basketball coach, and long-distance runner. She serves on Congresswoman Elisa Slotkin's Environmental Advisory Board, the Brighton Area Chamber Environmental Council, and the Citizens Advisory Work Group of the Michigan PFAS Action Response Team. Elizabeth?
Hi, thank you. Transportation accounts for 27% of US greenhouse gas pollution. So reducing tailpipe pollution will significantly help address the pollution that is harming our climate. But there are other important benefits. When we have strong pollution standards, we get more electric cars on the road faster. Electric cars have zero tailpipe pollution. And so they help not only reduce climate pollution, but all of the other harmful pollutants that come out of the tailpipes of cars. 12 Michigan counties have failing air quality grades, according to the American Lung Association, and 180,000 kids in Michigan have asthma. Strengthening clean car standards for cars, trucks, and buses is one of the best defenses to combat air pollution. It means less particle pollution and carcinogenic poisons from coming directly at our children's faces. Pollution disproportionately affects children more because their lungs, hearts, and brains are still developing. Stronger standards will also save money at the pump for families while cleaning up our air and protecting public health.
Thank you very much, Elizabeth. All very important examples of or explanations of why clean car standards have numerous benefits, both for children's health, for our economy, for all of our families who are trying to support themselves. I'm going to turn it over to finally Angie Whalen. Angie is an experienced educator with 8 years of classroom and school admin experience. She started her career with Teach for America and has taught in San Antonio, Shanghai, Austin, and Cleveland. She currently works at Hazel Health, a telemedicine company working to bring equitable healthcare access to students. She is motivated by the vision that learning experiences can positively alter the course of a student's life. Angie?
Thank you, Jessica, and thank you for giving me the opportunity to be here today to discuss how pollutants can affect children's learning from a classroom perspective. There is a direct impact of transportation pollution and incidences of asthma. According to the Institute for Public Health, chronic asthma is linked with greater stress, which can affect concentration at school, relationships with peers, and increases the risk of adolescent depression. In my career, I have been most interested in improving health and educational equity for youth and how that can lead to improved learning outcomes. Education does empower all people, and we should be motivated to take action for improving children's health.
Thank you very much for that statement, Angie. I think one overlying or common denominator between all of our groups, nurses, parents, moms, teachers, we spend a great deal of time with whether they're patients or students at home with our family. We spend a great deal of time together. And we're very much engaged and very much committed to health and wellness and support of our children and our future, because children are our future. So this conversation is very important of how we can better foster public health, especially for our next generation. So I just wanted to bring a couple of questions to the group to get your individual perspectives. From your personal perspective, what are some benefits, in addition to the ones that you've all mentioned, that you can see coming from transitioning to stronger standards that will reduce tailpipe pollution? And I was going to start with Gloria, if you had any comments on that.
I do. So tailpipe pollution may not seem like a severe environmental concern if you're only considering your neighbor idling in their driveway on a cold Chicago winter morning. But now let's imagine an entire fleet of school buses and other buses idling every morning outside of your child's school, and the cumulative impact of every single commuter in your state. It really does all add up. So to put things into perspective, the State of the Air 2022 report found that despite decades of progress on cleaning up sources of air pollution, more than 40% of Americans, over 137 million people, are living in places with failing grades for unhealthy levels of particle pollution, which includes that pollution from tailpipe that we're talking about today. So to be clear, this is 2.1 million more people breathing unhealthy air compared to last year's report. Nearly 9 million more people were impacted by daily spikes in deadly particle pollution that was reported last year. So in the 3 years that was covered by this report, Americans experienced more days of very unhealthy and hazardous air quality than ever before in the 2 decades from the history of State of the Air. So this is really more than a call to action. This is an SOS for all Americans, but we can fix this, and it starts with those strong standards that we're talking about right now.
Thank you so much. What a powerful image in your mind of, I'm just imagining a car line with a mom or a parent waiting to pick up their child, knowing that they have severe asthma, and seeing all those school buses with the emissions coming out, the car line, the emissions coming out, and just imagining the worry that a parent might have of their child's well-being, knowing that, you know, they're going to be impacted by that tailpipe pollution. Elizabeth, I was going to turn over the same question to you. What are some benefits that you would see coming from transitioning to stronger standards as a parent, as an organizer from Moms Clean Air Force?
Well, moms are known as their children's protectors and advocates. We talk about our concerns with asthma rates and personal stories about tailpipe pollution with our elected officials. I've given testimony asking EPA for stronger tailpipe protections, in addition to local advocacy by joining an anti-idling PTO group. We also have a coalition of experts from the public health, pupil transportation, electric bus, and energy groups that make up its electric coalition here in Michigan, where we help schools apply for electric school bus funding. We also meet with our federal and state representatives to talk about electric school bus funding and anti-idling programs. I tell the moms to reach out to their PTO and see if they can start an anti-idling program. Also reach out to your school board and see if they know about the EPA's electric school bus program. And of course, join Moms Clean Air Force. We have state coordinators on the ground in more than a dozen states who can help you find out how you could get more involved. You can go to our website at momscleanairforce.org, and then you click on the button that says join the force.
Thank you so much for that, Elizabeth. You're definitely reading my mind with the next question of what are some action steps? So that is super, super encouraging to know all of the things that we can do, because that is one thing that I find that people can easily get discouraged when you have an issue or a problem that seems insurmountable, or is very urgent and requires a lot of attention. Not knowing what those action steps are can seem very intimidating and can make the problem seem like it can't be addressed, or it can't be addressed. So it's nice to know all of the initiatives that you're working on and Moms is working on. And I would turn the same question over to Mr. Ramos. What do you think are some ways that teachers, or what are some things that teachers can do in their professional or personal lives to help better protect children from tailpipe pollution?
Thank you, Jessica. I'm a firm believer that to educate someone is to help them. So ultimately, when we're spreading the word, we are helping everybody. And with school, these parents and guardians are not aware that this is such a big cause of the problem why their kids are getting sick. So to me, if we're educating them on this now, I think this can help in the future, or maybe now, but hopefully for the future more so, that our kids do not have to worry about, I can't participate in dance, I can't participate in sports because I can't pass the physical test because I have respiratory issue. And it's just not fair because it's not their fault, And I think that when they can't participate, it trickles down. It affects them physically, socially, emotionally. And we all know that those are three big things right now, mental health in this new generation, especially coming from COVID and learning through Zoom and COVID. Our students are already suffering enough. This should not be another thing that they are worrying about. So to me, the more we educate the community, we can have somebody come in for career day. We have career day every year. So just to kind of be an advocate for this, because honestly, until you told me about this, Jessica, I wasn't even thinking about this. Like, oh my God, this is so true. I have bus duty morning and afternoon. The buses are lined up, parents are lined up, kids are there running around, being happy. And the next thing you know, I have a kid absent. Oh, they were sick. Who knows? That could have been the reason why they were. So I think to educate them is to ultimately help them.
Very, very well said. I absolutely agree. And it kind of goes back to Angie's statement in her bio. Learning experience can really positively alter the course of a student's life. So I would echo the same question to you, Angie, or from your personal perspective, what are some benefits that you see coming from strengthening these standards? Or what do you think teachers can do to get involved and be part of this conversation of how to strengthen standards?
Yeah, great question. And Mr. Ramos, I agree. And I think that all adults, including teachers, can and should do their part of small actionable steps to address pollution. But just like Mr. Ramos, I'd also encourage reading more and learning more, especially around the Asthma Friendly Schools initiative, which does focus on a framework and tools that communities and schools can use to provide an approach to asthma management. Asthma is one of the leading causes of school absenteeism. And as Gloria mentioned, on average in a classroom of 30 children, about 4 are likely to have asthma. So I really do believe that if we are to encourage and to educate, we could improve and manage that chronic health condition such as asthma, starting where students are, which is in school buildings.
Absolutely. I think that's definitely the foundation, and it's the key to this conversation, educating parents, teachers, bringing everyone together to know that this is a topic that needs to be addressed. There are lots of resources out there, whether they're from Mom's Clean Air Force, from national foundations, the Alliance of Nurses for Healthy Environments, just getting that information out into our networks, and then also knowing what we can do individually and professionally and within our communities to really, really make a difference. When we talk about tailpipe pollution from cars, just to bring it to a broader perspective, we have to think about climate change. And I would like to take this moment to mention that our thoughts are with those dealing with the devastating impacts of Hurricane Fiona in Puerto Rico, the Dominican Republic, Haiti, and other parts of the Caribbean. Another devastating hurricane season, while wildfires, heat waves, other natural disasters are occurring in the US and around the globe. The climate impacts are already harming communities in every part of our country. Can you all maybe talk about climate change specifically and its impact on school-age children? How is it impacting their health, their well-being, and their learning right now in this moment as we head back to school? Mr. Ramos, thank you.
Well, now that we're back in school, we would think that it's cooler, but it's been hot, and a lot of schools don't have AC. A lot of our urban communities don't have AC. So the inequality right there alone is ridiculous. So I think that kids should, I'm a bit advocate that kids should not have to worry about anything but being students. They should not have to worry about when am I going to be able to catch my breath? When am I going to be able to feel, comfortable enough so that I can come to school and not worry about, am I going to get sick here because of whatever reason? I just think that it is our responsibility as adults to educate, again, back to the education, educate the parents and guardians. We need to put it back on them. And I'm glad that the Moms for Clean Air Force is here, because parents do make a big difference, and it starts from home. And our job at school is to continue to reinforce that. So if we all work together little by little, I think we can achieve our ultimate goal.
So shifting this question back over to parents, Elizabeth, how would you say that you're seeing the impacts of climate change, whether it's globally or locally? How would you see that it's impacting school-age children in their health, their well-being, or their learning at this time?
Climate change is making it harder for people with asthma right now. I'm seeing that with my asthmatic son. Climate change is making it hotter and giving us heat waves and those extreme heat days. This heat makes air quality worse. That's hard on my son and all children with asthma. Poor air quality exacerbates his chronic illness. It's heartbreaking to tell him he cannot play outdoors because the air is unsafe. As parents of an asthmatic child, we weigh the benefits of sports, health, and mental well-being differently than some parents. Outdoor physical activity can be harmful when the air quality is poor, and therefore not healthy. Kids should be able to play safely outdoors with a friend or teammates without having to worry about being rushed home to use their nebulizer or going into an emergency room. Many kids miss school because of asthma each year. It can be hard to catch up, particularly after a pandemic, and these disruptions in their education for 2 years. We are also experiencing extreme weather events caused by climate change. Michiganders have had excessive rainfall in the spring, summer droughts, and less snow and frost in the winter. Our lakes and rivers are warming faster than our oceans, according to scientists. Our family has experienced flooding, high winds, tornado damage, and our lake only freezes for a few weeks, not months in the winter. Families in Michigan are feeling the impacts now. We must and can do more to protect our planet and public health from tailpipe pollution.
Thank you very much. That was a powerful statement of all the different ways that the impacts of climate change are affecting us in all seasons, across all generations, and unfortunately having a very lasting impact on our children. I think Mr. Ramos made a really good point. Children shouldn't really worry about anything but being children. And I would turn this question back over to Gloria. What are some ways that you personally are seeing, I'm sure as a school nurse, with the high incidences of asthma that children have, what are some ways that you're seeing that climate change are impacting children in schools today?
Thank you for the question. So school nurses are in a unique position to address the health impacts of climate change and to become fierce advocates of climate justice because of the populations that we serve. So school age and adolescent students are particularly vulnerable to the consequences of climate change, which include those that we've already discussed today. So poor air quality, increasing temperatures, and increasing pollen counts, which wasn't mentioned, but it's still very important. As nurses, we must address the impact of climate change on a local level by making changes in practice and also engaging in research so that they are prepared with the knowledge and skills to offer expertise in environmental health and for the care of school age populations. So that's what we're doing kind of at the beginning of just nursing education. But here in Illinois, what we're doing is ensuring that we, school nurses, have the necessary emergency medication on hand to handle asthma emergencies. For example, the stock albuterol is available already, but a lot of districts still don't have access to it. So school nurses are working with other stakeholders, for example, the Illinois Lung Association and AFA. And just to wrap up, I think it goes without saying, but nurses have been voted as the most trusted profession for 20 consecutive years now, according to the Gallup poll. We do have a voice and a responsibility to stand up for our patients and for our communities, for the nation's public health, really. We are those ideal advocates for increased climate action in the healthcare sector. So I would encourage any nurse listening to this to join ANNIE, the Alliance of Nurses for Healthy Environments. Engage at the local level. We already heard from one that you can join if you're a mom's clean air force. Join the efforts of any other local community that you see that is doing something impactful for environment, for example, the Lung Association chapter. So it really does start with that awareness and that action step. So I just want to thank you for allowing me to join this important conversation.
Yes, Mr. Ramos.
Just to piggyback what Gloria mentioned, I think we need to be an advocate at board meetings. Maybe talk to board members that this needs to be a priority. We have science classes, we have STEAM classes where we can really educate our kids on the importance of educating themselves and their peers on the importance of, clean air and, advocating for your future. So we all could do little parts, and those little parts can become big.
No, absolutely. I 100% agree. Education, we've all agreed that that is the foundation of action. And then from education, learning different advocacy and action steps that we can do, joining a coalition, joining an organization, a national organization like Moms or Annie that Gloria and Elizabeth have mentioned, reading statistics and educating your child on the importance, just as important as it is for a child to know their medication regimen and how to use albuterol or a rescue inhaler. It's important to also know the science behind air quality that will exacerbate or worsen their respiratory symptoms. So it's a very, very good point, and I appreciate that.
And as
Angie,
a mom, I would
Yeah.
also like to add that, PTOs and your school board is actually really excited to hear from parents. I have had nothing but positive feedback when starting an anti-idling program at our school. Many parents were on board, and our school board was very open to that, as well as applying for those electric school bus funds. They are available. They just did their first round through the EPA. They're going to be opening that up again to a lot of different districts. And it's pretty easy to find out if your school qualifies or getting more information. And once again, you can find that on our website as well.
Again, it's great to know about all these resources that are available coming from a national organization. And Angie, I think your background having taught in a number of different geographical locations across the country, from San Antonio to Cleveland, I would be curious of your perspective of how you're seeing climate change impacting school-age children and how it's affecting their health and their well-being and their learning.
Yeah, I I think from my experience and from what we've talked about today, we know that climate change puts children's most basic rights at risk, such as their access to health, to food, to water, to clean air, to education protection. I think even more specifically, climate change can impact education and learning directly through effects related to the damage of education infrastructure or loss of educational material, injury, mortality, and even psychosocial stress relating to the exposure of extreme weather events. I'm a firm believer, just like Mr. Ramos, that education can help students and families make informed decisions in the classroom. Young people, communities, parents, guardians can be taught the impact of global warming and learn how to adapt to climate change and make improvements. I believe that education empowers all people, and we should be motivated to take that action to develop strong clean car emission standards.
And the fact that we have resources, we have social media on our side. These kids, they learn everything off of social media. So if I can have a kid create a dance, a TikTok dance based on climate change and the importance of that, we've done our job, so use what they know. These kids are so amazing that they can handle it. They can learn.
They can learn and they can be a part of the conversation.
Yes.
and part
they
of
should be part of it. Yeah, because it is their future.
that is very, very true. I would definitely like to add that polling overall, we're clearly all on the same page that this is an important health issue. I believe Gloria said this is an SOS. This is a public health crisis. We are in a climate crisis. And polling has shown that the public are aware of the benefits of strengthening environmental safeguards and that there is strong, overwhelming support for increasing environmental protections under federal agencies like EPA. Last August, an executive order from the Biden administration was announced of a goal that 50% of all new passenger cars and light-duty trucks in 2030 will be zero emission. This order also included a directive for EPA to introduce an updated round of long-term clean car standards, and that's what we've been talking about today, the benefits of those standards, the urgent need for those standards, and that would be starting in model year 2027. So nurses, moms, parents, and teachers are coming together and advocating for stronger standards as soon as possible to continue the necessary transition to zero emission vehicles, to also improve air quality and to protect public health of our children. Over 300 nurses in all 50 states have already signed on urging EPA to propose cleaner car standards. And we have another opportunity to engage, as Elizabeth has mentioned, with the petition from Moms Clean Air Force. Once EPA's proposal is announced, we'll need to continue to engage in public hearings, in our communities, in our schools, in our homes, and continue to drive attention around the need for strong long-term clean car standards. These standards will be a critical tool to fight climate change, reduce air pollution, and keep our kids healthy. So thank you all for your perspectives and for joining us in this very important and stimulating conversation of, again, the issue that we're dealing with, and also the very important and positive action steps that we can take going forward.